Canada's vaccine rollout supply no longer appears to be the main problem, at least for the foreseeable future. The federal government is saying that millions of doses will be coming into the country. Here are the big numbers. 1.3 million shots of the Moderna vaccine arriving by late March. The Prime Minister says Moderna is now on track to exceed the 2 million doses promised to Canada by the end of March. And Pfizer-BioNTech also out with details on another big shipment. 1.5 million doses will be sent here in early April. Canada preparing to receive those vaccine deliveries, and then the work shifts to the provincial level. Provinces are scrambling really to get infrastructure and systems in place to start inoculating the general public. And John Northcott is looking at that and some of the problems, John, provinces like Ontario are having.
Yeah, Heather, we're trying to encapsulate this in a metaphor, and maybe a kaleidoscope is the best way of looking at this. By the time the vaccines arrive via the federal government to the provinces, and then to get distributed to the local health units across the country. And arguably, each one may be taking a different approach. Now, the key, though, is in most cases now, we're still at the provincial level as they set out, for example, who is eligible. And that's what we're seeing rolling out in Ontario. And some would argue it's later than other provinces, certainly several others, including, for example, Alberta and Quebec, in terms of the timeline and developing the logistical framework to get the job done. This has resulted in political backlash. Here's an exchange.
It's outrageous. I mean, these are the kinds of things that the Ford government should have been dealing with months and months ago.
At the beginning of March, and we're not ready. You know, it boggles my mind.
I'm going to respectfully disagree. We're far behind. We're leading the whole country. We're doing more than Alberta, BC. You combine all the vaccinations in the entire country. Ontario's doing more, so I don't know how we're falling behind on that.
The pushback from some on that is that Ontario, as the most populous province, had the most vaccines given to it in the first place, and on a per capita basis, perhaps aren't doing as well as some other provinces. Still, though, the man in the hot seat in all of this at this stage, before it then flows down to the local unit level, is retired General Rick Hillier. And here's an exchange on Power and Politics with host Vashi Kappelos.
We're in a ponderous, somewhat awkward and somewhat clumsy phase right now, where we, like I said, we are taking vaccines to the people as opposed to the people coming to the vaccines and people coming to mass vaccination centers, because that's the most efficient way.
You're talking in general terms, right? Where are those vaccination sites? At what time will they be open?
Well, Vashi, they are open as we need them and as the vaccine flow permits.
Still a lot of questions around this, whether it be from the province and whether that flow then goes to the local health units. 34 of them across the province. Suggestions from the retired general that, for example, there would be GPs involved in community hubs handing out the vaccines. Suggestions that, for example, service groups might be involved in getting people to the vaccination sites. Pharmacies, another issue as well, with discussions ongoing there. So all of this with a lot of question marks still, and a situation that as we move through the various tranches of people who are deemed to be eligible by the province and the provinces across the country, still a lot of questions likely to be heard. Heather?
John, as far as other parts of the country, other provinces are dealing with their own snags and snarls. Bring us some of those stories today.
Yeah, now Alberta is one that's been pointed to as having perhaps on a per capita ratio basis, better vaccinations than Ontario has been able to do. And the argument there being that they are moving into those out of the long-term care into the general elderly population that much faster. But in order to get that, they have to register. And what we found is phone lines being clogged, and at one point then the actual website to register crashing. Now, you could argue that is what's going to happen, especially on the first day when you've got several 100,000 people trying to get that potential life-saving shot. But that's the situation there in the province of Alberta. Quebec, again, lauded by many as having success, at least when it comes to vaccinating within their long-term care facilities. The issue now, though, is, and this is something that other provinces right across this country are probably going to have to come to grips with at some point, how do you deal with the elderly isolated in their own homes? And elderly advocates and the elderly themselves have their concerns.
It does frustrate me. I mean, I would like to go out, but I've been ordered to stay in.
We've been telling them for 12 months, stay at home, stay at home. And now they're being told, go with a neighbor, go with a friend, go with a family member in the same car. It's confusing messages.
The mentality of the government has to change and has to deal with the reality of us seniors, not the other way around. We're not there to support the government. The government is supposed to be there to support us.
You'll likely see this issue being raised with the elderly right across the country, especially those who are literally physically unable to leave their homes. What is in place for them? Even those who are mobile. We have snow across this country. As far as registering, how many are online? How many have phones? And they have phones probably, but some, in fact, have rotary dial phones. These are the granular aspects of the logistics that are being faced by healthcare providers right across the country. Heather?
John, thank you so much.